Case 13 discusses the forced and covert medication tactics that are sometimes utilized with patients that are placed in inpatient or residential facilities. This case mainly covers the medication of patients with dementia or psychosis, both of which are conditions that can heavily impair one's decision-making skills and perception of reality. This case notes that deceptive strategies, like hiding medication in meals or drinks, can negatively impact the trust patients have with their caretakers but is also good for their overall mental well-being. The case also briefly touches on biases in the healthcare community, like how race, age, and other elements will determine if forced or covert administration is acceptable or needed. Although these biases are important and should be discussed, they are not the central moral dilemma put forth by Case 13. The main question asked in this case is whether or not it is acceptable to medicate people when medication is against their wishes. This is a main question for a consequentialist because the principle of utility is made relevant. The principle of utility claims that actions are morally right if they promote happiness and morally wrong if they promote unhappiness. Consequentialists will have to determine if the happiness of the caretakers, the patient's family, and the patient in the future outweighs the patient's unhappiness during the time the medication is administered. This is also the main question for someone who follows Kantian ethics because the motivation for giving this medication must be figured out. Kantian ethics states that the only thing that is truly good is the goodwill, or acting out of obligation to moral duties. Kantians will need to ask themselves, are the caretakers giving this medication to the patient for the patient, or for themselves since it might make their workdays go by a little bit smoother? Social contract theorists would also consider this the main question. Social contract theorists believe that everybody agrees to certain contracts in their everyday lives, like not jaywalking or committing robbery, and someone's actions are morally acceptable if they are following an agreement. The question in Case 13 is an important one to social contract theorists because it makes them ask, are there any instances where not agreeing can be overlooked? Let's dive a little deeper into a social contract theorist's view of this case.
One very important thing that needs to be considered when trying to formulate an answer to this question is the context surrounding the medication administration. Having a little background information can severely impact the moral conclusion we come to. Let's say patient number 1 willingly goes into a care facility and signs multiple forms, including one where they give consent to taking medication, even if they retract consent later on when in a different mental state. Forcing or fooling patient number 1 into taking medication would be okay since they agreed to this both personally and on paper. Now let's consider the patients that are institutionalized by force, which is the case for many people with psychosis, as they may harm themselves or others. Patient number 2 has not agreed to be in the facility and has definitely not signed any medical forms stating that they give consent to anything. While medicating them and placing them in a facility might be what's best for them, they have not agreed to this treatment, making forced medication immoral. The biggest problem us social contract theorists face when analyzing Case 13 is how drastically consent and agreements can vary case by case. However, in order to come to a conclusion, we'll assume that a large number of these patients, while in a lucid or stable state, decided to live their lives with the pleasure of others in mind. Many people agree to try to increase the happiness of others when possible, so this assumption is not unlikely. If we apply this agreement to their situations, forced medication would be okay if it brought others pleasure. This pleasure could be the happiness of the caretakers knowing their shift may be easier and less dangerous, or the peace of mind of their families knowing their loved one is getting help for whatever it may be that ails them.
Due to the fact that the context of each case and the personal decisions of each patient drastically affects the conclusion a social contract theorist could come to, the response given is not generalizable and is unsatisfactory. While social contract theory holds up fairly well when analyzing simpler things, like not running red lights because we agree to follow the rules of the road when we get a license, it runs into issues when faced with more complex situations like the ones mentioned in Case 13. Because of this, the viability of social contract theory is heavily decreased. To finish up this case study, let's look at a more specific example from everyone's point of view. The situation is this. A patient consents to taking medication when they are lucid. Is it ethical to trick them into taking their medication when they are no longer in a position to explicitly consent? We'll look at a consequentialist's perspective first.
During the process of being medicated, the patient may experience extreme distress or unhappiness. Trust between the caretaker and the patient may also be temporarily broken. However, taking the medication that has been specifically prescribed to them would ultimately be better for the patient's health along with the caretaker's safety, especially if the patient is aggressive when unmedicated. Like the name implies, consequentialists care about the consequences of actions, not the intentions or motivation. If the patient is given the right medication at a proper dosage, forcing or tricking them into taking that medication produces more positive consequences than negative ones. The patient is being treated and kept safe, the caretakers are kept safe, and the families know their loved one is being cared for. The positive consequences makes forced medication ethically acceptable.
Now on to conscience.
Healthcare workers, like the ones administering medications covertly or by force, are expected to abide by a strict code of medical ethics. One of the key topics within the code is the issue of consent. If the patient has consented to being medicated when they were in their truest and most present state of mind, the caretakers would be fulfilling their duties as medical staff to uphold and carry out their patient's wishes. Kantians often discuss acting from duty and in accordance to duty. Acting from duty is doing something because it's what you need to do, regardless of how you feel about it or what you gain or lose. Acting in accordance to duty is to act out of self-interest. Acting from duty is preferred and is considered morally desirable. If the person giving the medication is acting from duty and honoring the patient's lucid decision, medication that is administered by force or medication that is tricked into a patient's system is ethically okay by a Kantian's standards.
Finally, we'll touch base with our social contract theorist once more.
Knowing that the patient consented to medication at one point gives the context needed to come to a valid conclusion. If the patient agreed to taking medication when they were fully informed and mentally present, it would not be unethical to view their lucid consent as their true feelings, regardless of what they may say during an episode. The caretaker administering the medication also agrees to do what is best for the patient and carry out the patient's informed and lucid wishes. Since both parties have agreed to both taking and giving the medication prescribed, forced medication is morally acceptable.